Che. Today I'm going to be doing the muscular assessment and cerebellar function and cranial nerve testing. Hi Minerva, my name is Che. I'm going to be your nurse today, so we're going to be doing some series of testing, okay? So I'm going to provide privacy, wash my hands, make sure that I have adequate lighting. So for the purpose of the test, I'm going to have you follow my direction. If you have any pain in the process, just let me know, okay? So we're going to start with the neck. So I want you to move your head back, bring it back, turn to your left, bring it to the center, turn to your right, bring it to the center. Touch your ear against your shoulder. Do the same thing to the other side. Do you feel any pain?
No.
Okay. So the next thing we're going to do is to, I'm going to place, you're going to push your head against my palm, okay? So push. Push backwards. Push to the side. Push to the side. And that was for, I was checking for resistance. So the next thing I'm going to do is to do upper extremity range of motion. So I'm going to have you raise your hands up. Bring it down. Extend it backwards for hyperflexion. You bring it down. So move it away from your body. Raise it up. Bring it down to the center. Take it to the back. For internal rotation, bring it back. And then for the external rotation, you're going to place your hands behind your head. Then you bring it down. Alright, so that's for the upper extremity range of motion. So what we're going to do is I'm going to check for the resistance. So I'm going to have you push your hands forward against my palm. Move it backwards. Move to the side. Move it outside. Bring it backwards. So we're going to do the same thing to the side. Push it forward. Push it backwards. Push to the side. Push outside. There you go. Thank you. So the next I'm going to do is we're going to do the same thing to the forearm. So I'm going to have you make a fist. Push against my finger forward. Push forward. Just like this. Push forward. Push against. Backward. Place your thumb on your laps. I'm going to have you push against my palm. Push against my palm. Alright. Flip it forward. I'm going to have you open up. Curl. Like that. Squeeze. I'm going to have you squeeze my finger as hard as you can. So the next we're going to do is to flex your elbow. I'm going to have you flex, extend, do the same thing to the other side, extend. Alright, so I'm going to have you flip your palm on your lap like this. Alright, so clench your fist again, go like this, bring your back, go like this, extend it. Flex, up, down, up, down. Bend your fingers. Bring it back. All right. So the next thing you're going to do is to do radial deviation and ulnar deviation. I'm going to have you stretch your finger forward. Bring it inward for radial deviation. Take it outside for ulnar deviation. Bring it down. So, so the next we're going to do is I'm going to have you touch your finger to finger like this. Alright, thank you for doing it. The next step we're going to do is the lower extremity range of motion. I'm going to have you lie down, please, if you would. So what we're gonna do is we're gonna be doing some series of movements. So I'm gonna have you lift your right leg up all the way, bring it down, flex your knee, bring it down. Bend your knees again. We're gonna have you move it away from your body for rotation, bring it inward for internal rotation, extend your legs. So we'll do the same thing to this other side. Lift your leg all the way up, bring it down, flex your knees, and then extend for external rotation, and then move it inward for internal rotation. Stretch it down, please. The next thing I'm going to do is to check for resistance. So I'm going to have you try to push your leg against my palm. To do it backwards. To bend your knees again. Push against my palm. Thank you. We're going to repeat to the other side too. I'm going to have you push. Then to the other side. Bend your knees, please. Push against. Push backwards. All right, you can extend it back. So the next we're gonna do is I'm gonna have you move your leg away from your body for abduction. Bring it closer to your body for abduction. Just do one at a time, please. There. Bring it closer. Do the same thing to the other side. Bring it closer. All right. All right, so I'm going to have you sit up, please. So I'm going to have you kick your knee forward. Do the same thing to the other side. So push against my palm for resistance. Do the same thing to the other side. Okay, I'm going to check for resistance on the foot. Push against my palm. All right. So the next we're gonna do is to work on your toes. So I'm gonna have you flex your toe up for plantar flexion. Flex it down for dorsiflexion. For the purpose of this test, the patient has a foot surgery bilaterally, so she's not gonna be doing a whole lot of movement with her toes, but she will try to do as much as she can. So the next thing we're gonna do is I'm going to have you move one of your foot one at a time. Move it away from your body for evert. Bring it closer to your body for invert. So we do the same thing to the other leg. Evert outside, and then bring it in for invert closer to your body. So I'm going to have you, can you bend your toes?
No.
You can. Okay. At this point, she's not able to bend her toes.